In this video, we will talk about the aminoglycosides. So, aminoglycosides are water-soluble weak bases that are chemically similar and that one of two bases to which 2 or 3 amino sugars are attached. These amino sugars are linked to the biglycosidic bonds, hence the group link. The first aminoglycoside is named streptomycin, which is an antibiotic. It was discovered in 1943 by 3 American biochemists who isolated the compound from Streptomyces bruceus, a strain of soil bacteria. Aminoglycosides have been used in both veterinary and human medicine for years as a treatment for root and serious infections. They are very valuable for treating infections caused by gram-negative bacilli, including bacteria that may be resistant to other agents. So they end up in suffixes mycin with a Y, mycin with an I, and sin. However, if it ends in thromycin, it is usually a microlide and not a aminoglycoside. Aminoglycosides are almost always used with another antibiotic, so they're generally used to broaden the spectrum of coverage or act as an adjunct for therapy, and they're only administered parenteral, so that means that they're only administered via IV. Aminoglycosides are characterized by a core structure of amino sugars connected via glycosidic linkages to a dibasic aminocyclitol. So these are examples of aminoglycosides and their chemical structures. So we have streptomycin, gentamicin, streptomycin, amikacin for structural. For topical, we have neomycin and farmisetin. First example, we have the streptomycin. It is an antibiotic medication used to treat a number of bacterial infections including tuberculosis, Mycobacterium avium complex, endocarditis, brucellosis, Burkholder infection, plague, tularemia, and rat bite fever. In veterinary medicine, it is usually used as the sulfate salt and has been used to treat bacterial diseases in cattle, pigs, sheep, and poultry. Next, we have the gentamicin. It is an antibiotic used to treat several types of bacterial infections that may include bone infections, endocarditis, pelvic inflammatory disease, meningitis, pneumonia, urinary tract infections, and sepsis, among others. In veterinary medicine, gentamicin is used mainly as a solution for injection for pigs, cattle, and horses, and as an oral solution for poultry. For thromycin, it is an aminoglycoside antibiotic used to treat cystic fibrosis associated bacterial, lower respiratory tract, urinary tract, eye, skin, bone, and skin structure infections. For animals, it is used as a sterile topical antibiotic solution for the treatment of external ophthalmic infections in cats, dogs, and horses. Lastly, we have the amikacin. It is an injection used to treat certain serious infections that are caused by bacteria and infections of the blood, abdomen, lungs, skin, bones, joints, and urinary tract. For veterinary use, it is used to treat serious bacterial infections in dogs, cats, horses, ferrets, birds, reptiles, pocket pets or small mammals, and pet fish. And it is a bactericidal antibiotic, which means that it kills the bacteria that are sensitive to it. For the mechanism of action of the aminoglycosides, initially they penetrate bacterial cell wall to reach periplasmic spaces through porine channels or by passive diffusion. Further transport across cytoplasmic membrane takes place by active transport by proton pump and oxygen-dependent process. Next is they bind 30S ribosomal subunits and interfere via initiation complex, induce misreading of genetic code on mRNA, and lastly, breakup of polysomes into monosomes. So again, an aminoglycoside binds to a bacterial 30S ribosomal subunit, inhibiting that 30S ribosomal subunit, leading to decreased protein synthesis. So for its clinical uses, the bacterial targets of aminoglycosides are the gram-negative aerobic bacilli, which includes E. coli, Klebsiella, Proteus, Pseudomonas. It also includes Mycobacteria. It is not used for gram-positive aerobes, and they are not useful against anaerobes. For gram-negative bacillary infection, it includes septicemia, pelvic and abdominal sepsis. Aminoglycosides display bactericidal concentration-dependent killing action and are active against a wide range of aerobic gram-negative bacilli. For bacterial endocarditis, enterococcal, streptococcal, or staphylococcal infection of heart valves, they are also active against certain mycobacteria. For complicated infections, complicated UTIs, complicated skin or soft tissue infections, so they are effective even when the bacterial inoculum is large and resistance rarely develops during the course of treatment. These potent antimicrobials are used as prophylaxis and treatment in a variety of clinical situations.